Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Albinism, meaning white, is a non-contagious, congenital condition that's defined by a drastic reduction or complete lack of pigmentation in the hair, skin, and eyes. The skin is divided into 3 layers: the epidermis, the dermis, and the hypodermis. The hypodermis is made of fat and connective tissue that anchors the skin to the underlying muscle. Just above is the dermis, which contains hair follicles, nerves, and blood vessels. And just above that is the outermost layer of the skin, the epidermis. The epidermis itself has multiple cell layers that are mostly keratinocytes, which are named for the keratin protein that they're filled with. Keratin is a strong fibrous protein that allows keratinocytes to protect themselves from getting destroyed when you rub your hands through the sand at the beach. Keratinocytes start their life at the deepest layer of the epidermis, called the stratum basale, or the basal layer, which is made of a single layer of small, cuboidal to low columnar stem cells that continually divide and produce new keratinocytes that continue to mature as they migrate up through the epidermal layers. But the stratum basale also contains another group of cells, melanocytes, which secrete a protein pigment, or a coloring substance, called melanin. Melanin is actually a broad term that constitutes several types of melanin found in people of differing skin colors. These subtypes of melanin range in color from black to reddish yellow, and their relative quantity and rate at which they're metabolized define a person's skin color. When keratinocytes are exposed to the sun, they send a chemical signal to the melanocytes, which stimulates the melanocytes to produce melanin through a multi-step enzymatic reaction that begins with tyrosine. Once it's made, the melanocytes move the melanin into small sacs called melanosomes, and these get taken up by newly formed keratinocytes, which will later metabolize the melanin as they migrate into higher layers of the epidermis. Melanin then acts as a natural sunscreen because its protein structure dissipates, or scatters, UVB light, which, if left unchecked, can damage the DNA in the skin cells and lead to skin cancer. Melanin can also be found at the base of hair follicles to color hair, and in the eyes, including the iris, where it contributes to eye color, and the choroid tissue of the eye, where it helps prevent light reflection. Albinism is caused by a recessive gene mutation encoding any one of the enzymes needed to produce melanin. The resulting dysfunctional or deficient enzyme drastically decreases the amount of melanin that's made. Albinism can occur if there are mutations in proteins responsible for the transport of tyrosine, or melanosomes. It's linked to Shiraki-Higashi syndrome, which causes hypopigmentation, recurrent infections, mild coagulation defects, and varying neurological problems. Symptoms of albinism can be seen in the coloring of hair, irises, and skin. Coloring can range from drastically reduced pigmentation to white hair, milky white skin, and very light blue or translucent irises, which appear pink or red because of the retinal tissue lining the back of the eye. An absence of melanin in the eyes can lead to a variety of vision problems, ranging from focusing and depth perception to nystagmus and amblyopia, which is when there's misalignment of the eyes. In addition, albinism can cause freckles, moles, and lentigines, which are large freckle-like spots, to form on the skin, and it also increases the risk of skin cancers. Typically, diagnosis is initially made based on clinical observations, but a firmer diagnosis can be made with a skin biopsy or hair bulb extractions to test for the presence of melanin. Finally, genetic testing can give a definitive diagnosis. Treatment for albinism centers around preventing additional ailments that may occur from a lack of protection melanin normally provides. So, that means wearing tinted glasses to protect eyes or sunscreen to counter an increased risk of skin cancer. Some forms of albinism can be helped with medications that increase tyrosine levels, and others can be helped by low vision aids if eyesight is also affected. Alright, as a quick recap. Albinism is a recessive genetic condition causing dysfunction in one or more enzymes involved in the multi-step production of melanin inside melanocytes. A decrease or absence of melanin can reduce or obliterate pigmentation of the skin, hair, and eyes, causing them to appear lighter in color or completely white. Definitive diagnosis can be made with genetic testing and skin biopsies or hair bulb extractions to test for the presence of melanin. Treatment generally includes supplementing the protection melanin would have provided to the eyes and skin.
Thanks for watching. If you're interested in a deeper dive on this topic, take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine. Otherwise, you can always support us by donating on Patreon, subscribing to our channel, or following us on social media.